All right, today we're basically becoming medical detectives. We're going to decode all those fascinating clues our own bodies give us when something's off with our muscles, our nerves, or our bones. So let's dive right in and figure out how doctors crack these physical mysteries.
You know that feeling, right? That weird ache or that sudden weakness that just comes out of nowhere. It feels like a total mystery. Well, it turns out doctors have this incredible toolkit for playing detective. And that's what we're going to explore. Exactly how they read the signs your body is sending to get to the bottom of what's really going on.
Okay, so first up, unlocking body mysteries. We're going to start by looking at this amazing diagnostic toolkit doctors use, and we'll begin with one of the most fundamental sources of information they have.
All right, Section 2, Clues in the Blood. Now just think about your bloodstream for a second. It's like this massive information superhighway running through your whole body. In a simple blood test, it can reveal an absolutely incredible amount about what's happening with your muscles and nerves.
So first on our list of clues is magnesium. The best way to think about this mineral is as the ultimate stabilization for your entire system of nerves and muscles. It's really the key to keeping those communication lines running smoothly and, well, calmly.
And here's where it gets really interesting. It is all about balance. If you have too little magnesium, your system gets all overexcited. We're talking cramps, tremors, that kind of thing. But on the flip side, if you have too much, everything just slows way down. You get weak reflexes, you feel sluggish. It's this super delicate balance, and all sorts of things can throw it off, from what you eat to certain meds you might be taking. So, if you remember just one thing, make it this. It's super simple. Low magnesium, think twitchy nerves. High magnesium, think slow, weak reflexes. Easy as that.
Okay, let's move on to the next clue hidden in the blood, potassium. Now this one is important for all your muscles, for sure, but its number one most critical job is making sure your heart keeps a steady, predictable rhythm.
And believe me, the stakes with potassium are incredibly high. As you can see, it doesn't matter if it's too low or too high. Both can lead to really dangerous heart rhythm problems. In fact, when potassium gets very high, which can happen if your kidneys aren't working right, it's one of the most urgent, life-threatening situations a doctor has to deal with.
So, here's the bottom line. When you think potassium, you should immediately think heart rhythm. It is absolutely crucial for keeping your ticker going steady.
All right, next up we have myoglobin. So this is a protein that's supposed to live inside your muscle cells. So you can imagine if it starts showing up in your blood or your urine, that's a huge red flag. It's a direct signal that, hey, muscle tissue has been damaged somewhere.
And what makes myoglobin so powerful as a clue is its speed. I mean, it is one of the very first things to show up after an injury. That makes it a critical early warning sign for doctors who need to figure out how bad the muscle damage is, and fast.
Okay, let's talk about creatinine. Now this one's a little different. It's not just about the muscles themselves, it's really about the cleanup crew. See, creatine is a waste product that your muscles naturally make, and it's your kidney's job to filter all that junk out. So this test, it's really a way to check on how well your kidneys are doing their job.
And honestly, that's the perfect way to remember it. Just think of the creatinine test as a kidney filter check. If the levels of creatinine in your blood are high, it's a pretty good sign that those filters might be getting clogged up or just aren't working as well as they should be.
Section 3 is all about nerve and joint signals. Okay, so we've sifted through the clues in the blood. Now we're going to go even deeper. We're talking about tests that literally listen in on your body's electrical wiring and others that analyze the fluid from right inside your joints.
This one is called an electromyography, or EMG for short, and it is a fascinating test. Doctors are essentially eavesdropping on the electrical conversation that's happening between your nerves and your muscles. They're trying to figure out, are the signals getting through loud and clear, or is there some kind of static on the line?
And that's really its core purpose. An EMG helps a doctor figure out if a problem, say muscle weakness, is actually coming from the muscle or is it coming from the nerve that's supposed to be telling the muscle what to do. It's all about checking that critical nerve to muscle connection.
Next up, for joint pain, sometimes you have to go right to the source, and that's where arthrocentesis comes in. This is a procedure where a doctor takes a tiny sample of the fluid that lubricates our joints, it's called synovial fluid, so they can analyze it for clues.
Now the process itself is actually pretty straightforward. The doctor finds the right spot in the joint, carefully uses a needle to draw out a little bit of that fluid, and then off it goes to the lab. And in the lab, they're looking for all sorts of things. Signs of infection, inflammation, or even those tiny crystals that cause the excruciating pain of gout. And really,
That little sample of fluid can tell the entire story of what's going on inside a painful joint. It can give a clear, definitive diagnosis when other tests just can't quite pinpoint the problem.
Okay, so we've checked the blood, we've listened to the nerves, we've even analyzed the joints. Now it's time to see the big picture, the actual framework of our body. We're moving on to the tools that let doctors literally see inside of us.
This really lays out the big three when it comes to looking at our bones. And, each one tells a totally different story. First, you've got your basic X-ray. That's the classic, right? It's perfect for just seeing the raw structure. Is something broken? Is it lined up correctly? Then you have a bone scan, which goes a step further. It doesn't just show structure, it shows activity. It lights up areas where your bones are working overtime, which could be anything from a hidden stress fracture to an infection. And finally, there's the DEXA scan. This one is all about strength. It precisely measures your bone density to figure out your risk for things like osteoporosis.
Okay, last section, your diagnostic map. We've gathered all these different clues, from the blood, from the nerve signals, from the images of our bones. Now, let's put the whole puzzle together.
And here it is, the final map to help you remember everything. Let's run through it. Magnesium, that's your nerve and muscle stability. Potassium, all about the heart rhythm. Myoglobin is that super fast muscle injury marker. Creatinine is your kidney filter check. EMG checks the nerve to muscle connection. Arthrocentesis gets the real story from the joint. And finally, imaging lets us see a bone structure, its activity, and its overall strength.
When you look at it all together, each one of these tests is like a unique window into how our bodies work. They would allow doctors to stop guessing and start knowing exactly what's wrong. It's pretty amazing, and it really makes you wonder, right? With technology moving this fast, what other incredible medical mysteries are we going to be able to solve next?